Thank you so much. Wonder of wonders, we found a bit of time for me to ask a question. I want to draw your attention away from the substantive sections of the bill and the clauses to the preamble, which signals aspiration and intent. And we heard before your panel, we heard from members of the autism community, and they felt very strongly about the language in the preamble. It describes autism as a lifelong neurodevelopment disorder, talks about impairments, and their view is that this language takes a deficit approach as opposed to an asset-based approach, and they described it as dehumanizing and segregating. I wonder if you have, both of you, Dr. Salt and Dr. Lemay, have a response to that rather visceral reaction to that language.
Dr. Salt, do you want to go first?
Sure. So in this conversation and in this topic, I wear a number of hats, as I previously said. I can definitely see the perspective. The term impairment is a negative one. Neurodevelopmental disorder, that is the clinical distinction, and if we're looking to change that, then we need to. I think we need to look wider than just this bill, if that is the language that needs to change. So I think there are some language changes that could be made. I understand that previous people who have testified are submitting resources to that effect, and I don't think I have anything to add to what they have to say. It just I want to make sure that we, while we don't want to think of, while we don't want to use a lot of these negative terms, we also need to use terms that our society has defined for these roles. And I think that may be a broader discussion with overall society rather than just this bill. It doesn't mean this bill can't be a start of that, but I think it is a part of a much larger discussion. So I fully acknowledge that there can be some problematic language in the preamble, and I'm confident that that can be fixed.
Thank you, Dr. Lemay.
I totally agree with Dr. Salt. I just want to add one more thing. I know that DSM-5 is using the word deficits into it. I would say that on a day-to-day basis for the last 33 years, I've never used the word deficits when I was talking to parents. I try to use words such as strengths or challenges and points to be improved or points to be working on it. And always when I'm asking parents, I always start by asking, what are the gains you're seeing in the last year about your child? What are the challenges? So I'm trying to use those words. And these are the words that parents understand. If you talk about deficits, honestly, I'm not sure if it, especially so stressful for parents when you're talking about their child, you have to use words that they understand on a daily basis and that are not having a connotation that could be misinterpreted. And I totally support what Dr. Salt said. I'm totally in agreement.
Thank you so much to both doctors for their expert testimony. It helped